We're looking at every element of our personal protective equipment and infection control inside the hospitals. We don't have an answer for this right now.
A second healthcare worker at a major Dallas hospital has been diagnosed with Ebola. And while there are ongoing concerns about treatment protocols, officials say they wasted no time reacting after hearing word of the new case. They quickly sent a cleanup crew to the worker's apartment. Emergency teams were dispatched to alert hundreds of neighbors. Lyndsay Duncombe is on the story outside Texas Health Presbyterian in Dallas. What more do you know about this newest Ebola case, Lyndsay?
Well, I've actually moved, Suhanna. I'm standing near the home where this woman lived, and you can see the police tape because it's blocked off from us. And what we know about her is that she was a healthcare worker. She worked at the same hospital where this man who came in and died last week was being treated. She was treating him. Yesterday, she felt a fever. She went in, she had a test. She was put in isolation and awaiting confirmation of a final test, but she is tested positive for Ebola, making her the second healthcare worker here to be diagnosed. Then what happened is the city of Dallas stepped in. They put a reverse 911 call to all the people who live around here in a 4-block radius. They went through, decontaminated the outside of her apartment and common areas in that area. And this afternoon, another crew will come in. What they'll do is they'll go in and decontaminate the interior. This is something that the city has had to do 3 times now, and they say they are proud of the way it was handled today. Here's a spokesman from the city.
To be fair, this is our 3rd run at this in a very short amount of time. So I think I can speak for the city when we say we're very proud of the effort that we have put together in working with our partner agencies to really to get this done quickly. And you all have been witness to how everything has proceeded, and I think today we got things done as quickly as we could have.
So quickly that it was the sound of helicopters that woke up some residents here as this process began. How are they feeling? I'd say a little bit anxious. They want to know, did she use the gym? Did she shop at the same grocery store? But for the most part, that message that Ebola is something you have to be in close contact with someone who has symptoms is getting out to people. The larger concerns it seems to be how people who are working in the hospital are getting sick. At least that's what one resident told me not long ago.
I'd be a little concerned with what's going on, what went on in those emergency rooms and those waiting rooms, things like that. Absolutely. Absolutely. Why? Well, aren't they supposed to be the ones that are the most protected, the most knowledgeable in how to treat this and not transmit it? It seems like the smartest people are the ones getting the sickest.
And Lyndsay, there has been a lot of criticism leveled at the hospital. How is it responding?
Well, a little bit defensively. We heard that at a news conference earlier today where one of the top doctors at the hospital said, listen, obviously if we could go back and do things differently, we would, but we're learning from this experience. And really the whole country is learning from this experience. The new practices, including if there is a Ebola diagnosis somewhere else in the States, the CDC says they'll now stand in a rapid response team. That's because of what happened here. The fact that the CDC is retraining people on asking more detailed travel histories. Have people with symptoms been to West Africa? That's because of what happened here. Because, of course, when that first patient walked into the emergency room the first time, he was turned away, even though he had said he had been to Africa. So certainly lessons are being learned here. They're being shared. But all the concern right now is for those 2 healthcare workers who are at the hospital not far from here. And the relief, the good news is that that first healthcare worker, the 26-year-old nurse who was treating this patient who died, her condition has been upgraded. She is said to be in good spirits, and a lot of people relieved to hear that, Suhanna.
Thank you, Lyndsay. CBC's Lyndsay Duncombe in Dallas, Texas.